I'm Dr. Tara Moon. I'm the Division Director for Clinical Laboratory Science at the University of North Carolina, and we're here at the Transfusion Medicine Service at UNC Health. This is where I started early in my career and actually inspired my love for blood banking and transfusion medicine, and so I'd like to show you what it's all about. This transfusion service is very unique because it also includes an apheresis center where patients come. So the staff in the clinical lab at the transfusion service are involved in preparing products needed for apheresis for certain types of patients like sickle cell anemia, some cancers where they donate their own products for themselves or others that are going to be used later, or some other hematologic conditions. This part of the clinical lab involves collaborating with other healthcare professionals in addition to the laboratory professionals, so they work together to provide products for these patients. This is the compatibility part of the transfusion service. Before any transfusion, we have to ensure that the product that's going to be transfused to the patient is compatible. So we do lots of different types of testing to ensure patient safety, so that it can include things like a blood type, an ABO/RH, a cross match between the donor and the recipient, or an antibody screen where we look in the patient's plasma to see if they have any antibodies that may react with the recipient. Much of the testing that we do for compatibility is still very manual. We use test tubes and agglutination viewers and have to do a lot of problem solving and troubleshooting, especially when it's a very complex patient. We also have some automation in this space to use, but it's mostly for routine testing. When it comes to an acute situation where a patient's in need of having products very quickly, we still revert to the manual methods. That's still the quickest way to get them a blood product in a time of need. This is an example of an automated analyzer that might be used in a transfusion service. We use the automated analyzers mostly for routine testing, things that are scheduled in advance, maybe an elective surgery that's a couple days away, or sometimes for prenatal screening for obstetric patients. These are examples of two blood products that patients may receive, red blood cells, or they might receive just the liquid part of our blood, what we call plasma or fresh frozen plasma. Before every transfusion, we are really careful to make sure that these products are stored properly at the right temperature, and that's regulated. These products are tracked all the way from the donor center, wherever they're collected, and monitored when they get here for their temperature to make sure that the patient receives a safe transfusion. This is another example of a blood product that a patient might receive. These are apheresis platelets. So this is the part of your blood that helps your blood clot when you might be bleeding from an injury or for some other reason. We have lots of patients at UNC Health that need platelets: cancer patients, burn patients, patients that have had a procedure or in the operating room or have had some kind of trauma often need platelets. It's a product that's always at a critical inventory. So our transfusion service at UNC is constantly recruiting for platelet donors, and even has their own platelet donor center. We are in the components area of the transfusion service, and in addition to processing all of the products that patients need for transfusion, this is also where they get signed out to the patient bedside. So another member of the healthcare team will come to this window behind me and bring the patient's information. We will compare that to what we have labeled the product with and make sure that there's a clerical match, that the right product is going to the right patient. We have to be really careful about that. Normally, we'll just sign out one unit of a product at a time, but in some situations, like acute situations in certain settings, like the ER or the operating room where a patient is in crisis, we might sign out multiple units of a product at one time. So we'll pack up a cooler with ice and send multiple units so that the patient can receive them very quickly. Like Like any part of the clinical laboratory, the laboratory professionals that work in the transfusion service need to have a lot of attention to detail. They also need to be always thinking about the patient. It's a part of the laboratory where we can have a very immediate and direct effect on patient lives. The laboratory professionals that work in the transfusion service are saving lives every time they do a cross match or sign out a unit of blood.